So as Sarah mentioned, sort of the next step when you're looking at your strategy is just really thinking about what some of the barriers and facilitators might be. So what could help or hinder reaching your audiences? Is there anything that you might be missing? And again, talking to your audiences is a really good way to figure out what some of these barriers or facilitators might be. And quite often they're related to either accessibility, cost, it might be feasibility. So you want to make sure that you're considering all these potential pieces. So, for example, if you're trying to inform patients, have you used summaries or tools with appropriate language? Or if you decided to use a webinar or a podcast, does your audience have access to computers? Do they have time to access a live webinar? So just sort of thinking about, how you're planning to roll out your strategy and whether or not there's any potential barriers or facilitators.
So going back to the example I was using before, and goal 2 is to provide accessible evidence to our knowledge users. Some of the barriers specifically to our different knowledge users we could think of at the time were for clinicians, whether or not they had open access to publications, whether they had time to read our publications, whether they had Cochrane membership or were aware of what Cochrane is and the evidence and tools that it can provide. For parents, because of a lot of our tools that we were developing were online, so things like access to computer, whether they had internet access. The other barrier we thought of was whether or not English as a first language was going to come into effect. So a lot of the tools that we create and the messaging that we put across is currently only in English. As well as knowledge of the health system was something that we thought parents might find a barrier to being able to work out where the evidence is available. And in terms of Cochrane Child Health from a practical standpoint, things like resources, how much time we could invest in these activities, and also whether or not we had funding for these specific activities. But in saying all of that, we really had a few things that really helped move a lot of our activities off the ground. Things like offering CME credits for participation in training for clinicians was also a nice incentive for them. The use of social media as well has kind of helped us work around some of those open access issues. So we can actually put up publications or have a special site where publications are available, which we think has increased awareness of Cochrane and the evidence that's provided. For our parents, one great thing that we've been able to work with is a pediatric parent advisory group. And this is in collaboration with Arch and Echo, who Dr. Lisa Hartling and Dr. Shannon Scott developed. This is a group of parents who I'll talk about a little bit later, but they come together and help facilitate some of the research by giving feedback on what works and what doesn't work. We run focus groups on where's the best place to disseminate this type of evidence and in what format. And they're also helping us work on translating some of these tools into different languages. And then in regards again to the field itself, we have a number of partnerships in place with collaborators to facilitate journal production, social media posts, and the development of KT tools. So a lot of those things kind of we've capitalized on existing relationships, and that's really made the facilitation of a lot of our activities happen.
So the next part of your KT plan is taking a look at the expertise that you might have or might need to roll out this type of a KT plan. So essentially, is everyone around the table that should be? So what expertise do you have on your team? What expertise might you need to bring in? And just thinking about your team's ability to execute the proposed strategies. So for instance, if you're targeting patients, do you have someone on the team that can write plain language summaries? And you might also want to consider having a patient at this table. Or there may be other members of your target audience you might like to collaborate with or include. And as I had mentioned before, it's really to think about who's the most credible messenger to deliver your message and make sure that you're bringing together all of the appropriate expertise to get the job done.
So at Cochrane Child Health, we lean on a lot of our knowledge users who work with us to develop some of these tools and on the different activities. So a few examples I've mentioned before was the Cochrane Corners. So for this, clinicians help set the topics and they write the commentaries. We have a partnership with TREC, which stands for Translating, excuse me. Sorry, TREC, we developed bottom line recommendations for clinicians based on evidence repositories that Cochrane Child Health has helped develop. The KT tools for parents, so working with clinicians and the pediatric advisory group to ensure the right messaging is used and perhaps the right platform or interactive story. With our social media strategies, we work and collaborate with other health researchers in this field, as well as knowledge translation researchers and clinicians. And as I mentioned before, our pediatric parent advisory group, who we work with in collaboration with Arch and Echo, they really provide the advice, guidance, and knowledge from a parent's perspective to help inform our activities.
So of course, Sarah talked a little bit about resources earlier, but it's an important part of achieving your goals. You want to make sure that you actually have the resources to make this happen. So you need to think about not just financial resources, also human resources and access to resources. So you want to think about, cost to publish or attend conferences, printing educational material, hosting webinars and video conferences, and just making sure that you list out and map out all the resources required for each one of those strategies that you selected.
So for an example of when you're working within a limited budget or have no budget, partnerships and collaborations are really paramount to the success of some of these activities. So for example, for goal 1, for dissemination, we partnered and worked with editorial chiefs of different journals to help get our commentaries produced and published. As I mentioned before, Arch, Echo, and TREC partnerships all help with the development of the KT tools and the dissemination of bottom line recommendations to clinicians. For our second goal in making sure we have accessible evidence, the Arch Echo partnership for the development of KT tools and the support from the AB4U KT platform has helped us to translate and test the usability of these tools in different languages. And what we also have found really useful is applying for small targeted funding for different aspects of our KT strategy. Sometimes it's quite difficult to get funding for your entire strategy, but if you break it down into smaller pieces, you might be able to get funding for specific activities and you can help build on your KT plan. And that's really helped us prioritize what we do and have the expertise and resources for. So we're really fine-tuning our activities based on what's available for us. In a perfect world, we would have all the funding, all the resources, and all the expertise at our disposal. But I think most of us know it's not like that in research or the real world. So you really have to be quite strategic, and thinking through some of those elements Gabrielle talked about has really helped us in being strategic with our plan. And in the interest of time, I'm not going to go through our entire plan, but I just want to reiterate the things that we kept coming back to as we were developing it, and that was who's our audience, what are we doing, and what are we hoping to achieve. And so here's just an example of some of our activities relating to our different audiences, what products we produced, and what the goal of that KT product was. So this table is specifically for looking at how we produce evidence to meet our knowledge users' needs. And the second table is all about making the evidence accessible to our knowledge users. So if anybody ever wants to go through those tables and ask me any questions, they're more than welcome to. So when I talked about what goals we wanted to achieve in the beginning and how we linked that to the KT, the Cochrane KT framework, while we really specifically targeted 2 of the goals, a lot of our work will also have a flow-on effect. And it actually reaches different domains of the framework, such as network building, building demand advocacy, knowledge translation outputs, and stakeholder engagement. And so through all those activities, we hope to contribute to the goals of Cochrane Strategy 2020 by helping to produce accessible evidence in an effective and sustainable manner, which I'm sorry everyone, I'm quite sick today, which meets the needs of our knowledge users. But one question that keeps coming up all the time, and I think some of the audience asked this, is how do we know what we're doing is working? And Gabrielle will go through the KT impact and evaluation.
Right, so as I said, you need to make sure you build in an evaluation plan right at the get-go so that you know whether or not you're achieving your, your goals. And your evaluation can be process-based, outcome-based, or impact-based. And for your desired impacts, you need to determine the associated outputs, outcomes, and indicators. And it's sometimes helpful to create a logic model type of a flow for that. And the type of indicators used in the evaluation are going to depend on the purpose of the evaluation, the KT activities you use, and the resources that you have available. And so first off, you might want to start by thinking about where is it that you want to have an impact. Is it at the healthcare outcomes level? Is it at the clinical practice level? Is it at the policy or systems level? Or is it at the research and knowledge level? And it could be multiple levels. You might want to have impact at multiple levels, but just consider what's feasible and what you're able to evaluate. And so when you're looking at, figuring out whether or not you've reached your KT goals, there's a number of indicators that you can look at. And so I've listed a number here, and this is based on a KT planning template that was developed through the Hospital for Sick Children, and they have more details online. But when we're thinking about reach indicators, this is, looking at basically your reach. How many tools have you distributed? How many have been requested? How many downloads or hits did you get on your website? And other kinds of media exposure indicators. There's usefulness indicators where you can look at what's been read or browsed. Quite often it's helpful to have qualitative measurements or qualitative tools to measure this. So looking at satisfaction, you kind of need to ask the people to know whether or not it's been useful. So you might have to develop a survey or a questionnaire. Use indicators is looking at whether or not the information was used. So, or you can look at, again, through qualitative methods, the intent to use and whether or not it was used for informing policy or programs, etc. There's partnership and collaboration indicators, because that might be one of your goals too, is to create more partnerships and collaborations. So you can look at the numbers or types of partners or capacity building efforts that you've developed. There's practice change indicators, where you can look at, sort of that intent again or commitment to change, or you can look at observed change or reported change. There's policy indicators. You can look at documentation or process measures. And, there's different knowledge attitude change indicators. And again, you can use quantitative or qualitative methodologies to collect information on these indicators. And you want to think about too whether or not the impacts were meant to be short-term or long-term, because that will dictate what indicators that you might choose. And as I said, the indicators need to provide reasonable, useful, and meaningful measures of the intended outcomes, and they have to fit with the resources available and the scope of your evaluation.
So, as we thought through our KT strategies, these are some of the questions that we kept coming back to in terms of how we would evaluate it. So what impact do we want our KT activities to have? We link these back to our KT objectives, which were to increase research and knowledge around child health topics, and to make sure that in clinical practice, Cochrane evidence on child health topics was available. We wanted to create behaviour change, so actually the use and uptake of this evidence, but also increase awareness around Cochrane Child Health and what evidence is available. So a few examples of how we know if this impact impact was achieved. For reach, we wanted to look at if there was an increase in our Twitter followers, for example, and perhaps the number of systematic reviews and bottom line recommendations that were downloaded. In terms of use, whether or not there's an increased use of Cochrane evidence in treatment guidelines or bottom line recommendations. And practice change. This one's a bit difficult, but perhaps through some of our dissemination efforts, there'll be less visits to the ED for common acute pediatric conditions. In terms of how we wanted to obtain this information, so there's a few different tools out there, but for clinical practice behaviours, you could use the perfect tool for qualitative measurements. And then for some of our more quantitative methods, looking at online social media and Google Analytics, we could get some of that information. And then it's really lovely to collect all this information, but what are we going to get out of it? And the one thing that we really wanted to be able to do is to refine our KT strategy and understand what works and what doesn't and why. So to sum everything up, we're still in the process of developing an evaluation plan for our KT strategy. But some of the things that we came across when we were developing our strategy was, where do the boundaries between knowledge translation of Cochrane evidence and other high quality evidence overlap? You know, as a field, one of our mandates is to share and provide accessible evidence. Cochrane evidence is known for being of the highest quality, but there is other evidence out there and other tools which might be just as useful. And where do we start looking outside of Cochrane and build some of that work into our KT strategy? One thing that we really, when we reflected about how successful we had been, was that we had really capitalized on existing partnerships, and breaking things down into smaller, more fundable pieces made things more manageable. For our priority setting work, we received a grant specifically for that activity. But without that funding, we wouldn't have been able to undertake that activity. And that's a big chunk of our KT strategy, was looking at what the priorities are in child health and how we can do more work around them. And I think I set it out from the beginning, was that we wanted to look at how we fit in with the current Cochrane KT strategy. But if we were developing this from scratch or before the Cochrane KT strategy had come out, what would it look like and how different would it look? What are the field's priorities meant to be now? Do we act as knowledge brokers? Are we still meant to fit in with the KT strategy? These sorts of questions just kept coming about, and I would love to sit down with other fields or other Cochrane review groups and have a chat about how they see a field and where they think we can be positioned to improve other groups' KT efforts as well. And one thing I really found quite helpful is kind of, and Gabrielle touched on this a little bit, focus on what you want to achieve. So what are our goals? And then work backwards to make sure we're doing the right activities to create the right products in order to achieve those goals. So as I said, our evaluation plan is in development, but hopefully over maybe, I'm thinking the next 6 months, we'll be able to share some of that preliminary evaluation plan with everyone, and we'll also go back to the drawing board and find out what has worked, hopefully, what hasn't, why it hasn't, and what can we do to improve that. And hopefully we can run another webinar again to update everyone on that, and hopefully others can learn from what we've done.